Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Christie Mulholland, palliative care physician and physician development coach. Today's Kevin MD article is Five Things Healthcare Must Stop Doing to Improve Physician Well-Being. Christie, welcome back to the show.
Hi, Kevin. For having me. Great to be back.
All right, so tell us what led you to write this article and then talk about the article itself for those who didn't get a chance to read it.
So, I was doing my end of year reflections and I was thinking about these patterns that I noticed that keep coming up in my conversations with well-being leaders and other doctors around the country. And they seem to be trends. So, these are five things that I think we need to leave in 2025 if we want to get serious about really improving physician well-being.
All right, so tell us about those five things that you're seeing.
All right, so I'm going to start with thing number one. And this is we must stop blaming younger physicians for not wanting to work as hard.
Hmm.
I've been hearing this narrative come up. I hear it talking with, more senior faculty members. I hear it from well-being champions that I work with. I see it in the news media, but there's just this idea that this generation is different, right? They feel more entitled to having work-life balance. There was an article in the Wall Street Journal that summed it up, and the article is called Younger Doctors Want Work-Life
Hmm.
Balance. Older doctors say that's not the job.
Hmm.
But I think that this narrative, and it's often couched in concern, right? Like older doctors are saying that younger doctors are missing out on their own learning and their own development because they just want to get their work done and go home. I hear faculty members that are really frustrated. They want to provide teaching to residents or mentorship, and the residents aren't showing up. Their younger faculty are declining committee work and they're not building their CVs. But I think that the narrative that this is a younger generation and the generation is different, I think that gets it wrong. And the reframe that I offer is medicine has changed, right? You and I talked on another episode about how the space to do good work in a bad system is narrowing over time as
Hmm.
healthcare has become more corporatized. And I really think this is what's happening with younger doctors. They're having a rational response to these changes in the system. The system, that the administrative work, the hoops, the hurdles that younger doctors are jumping through, and the time that that's taking away from actual patient care, they're feeling less rewarded by the job. And so the response to be very protective about their own boundary setting is a rational response because the system's not going to protect their boundaries. They're setting boundaries for themselves. And I think that we need to stop this narrative. We need to stop blaming the younger doctors because we should pay attention to their behavior and what it's telling us about this system and how we respond as a profession to this new generation is really going to inform what medicine looks like going forward and making sure that we have enough doctors staying in medicine for the long haul.
So I'm hearing that when these older physicians bemoan younger physicians wanting work-life balance, medicine was different back then when older physicians were training and practicing, and now medicine is beset by so many things that are non-clinical, like you mentioned, administrative burdens, pre-authorization, and so many things that prevent physicians from applying their best clinical work. So today's medicine is different from medicine of a generation past.
It's different. And once in a while I actually have heard some older doctors kind of admit that, right? Like we didn't have to see as many patients back in the day. We had time to sit down and have a journal club or have a water cooler conversation. And nowadays, those water cooler conversations just aren't happening because there are too many patients to see, number one. And number two, the water cooler space probably got repurposed for something else,
So
revenue generating.
how can we balance the concerns the older physician has with the changing expectations we should have for younger physicians? Is there a middle ground?
Well, I think so. And my general approach that I would recommend is let's make space for people that care about being a doctor and want to continue being a doctor. Let's listen. I think that Wall Street Journal article, it sparked a lot of discussion online. and
Hmm.
in comment threads. And I
Yeah.
admit I participated in some of that, but this debate came up about medicine. Is medicine supposed to be a calling or is it just a job? And I think my tendency is to say that both answers are valid. I think that this is actually a really rich coaching question. What is medicine for me as an individual doctor? Is it a calling for me or is it just a job? And maybe it's a job that I really care about. I want to do a good job. I've invested a lot in it, but I also have other parts of my identity that deserve some space and time. And if we listen and encourage people to get clarity on that for themselves, I think there's space for everybody. So my answer to that is yes. And, let's keep doctors in medicine, even the ones that don't find, sort of a spirituality in making all the sacrifices that it involves to be a doctor.
So I see the same conversation as well, whether medicine is a calling versus a job. One thing I want to ask you is that for those who see themselves where their identity is more than just being a physician and maybe sees clinical medicine as a job, can they still be good physicians?
Absolutely. They can still be good physicians, and they can do that by showing up with integrity. And the first step of integrity, of having integrity and acting with integrity, is being really clear on what you value, why you're showing up to be a doctor every day. Now, if your clarity is that you're showing up to be a doctor every day for the money and that's it, that might tell you some important information. And if you value, living your life with integrity or living aligned with your values, maybe you shouldn't be staying in medicine. And that's okay too. But yes, I think it's absolutely possible to see medicine as just a job that you care about, a job that you're going to set some boundaries around for yourself, but you're very in touch with your why. Why are you showing up? I'm a palliative care physician and I want work-life balance, but I know that when I show up for my shifts, I want to be fully present with my patients and their families and provide the best care possible because they're meeting me at the most difficult moments of their lives, and I need to show up fully for that. And part of how I show up the best way I can as a doctor is to have balance in my life.
How do you coach younger physicians who may be a little bit conflicted? Because all through training, they've probably been taught by the older generation that medicine is a calling and medicine should be the overwhelming priority at the expense of other parts of their identity. And now you and I were talking, and I'm in the same space that physicians are more than their degrees, and not everyone wants their identity to be purely a physician. Some physicians want to be known as husbands and wives and fathers and mothers to their children, and sometimes that's going to come some at the expense of the resources spent traditionally on clinical medicine. How do you coach younger physicians who may be a little bit conflicted? Now we're telling them something that may be a little bit different from what they've been previously taught.
Well, it's a lot of untraining, right? It's untraining of everything that they've been told over and over again by that older generation, and it's retraining that what they're feeling inside and what they know about themselves to be true is okay and it's valid. I think it's also getting people out of their silos,
Hmm.
right? There is a world outside of that ivory tower of academic medicine or medicine in general. And if you are spending all of your time and energy being a doctor, being around other doctors, and working all the time, then you are not going to have an opportunity to make connection and community outside of medicine and talk to people that work in other fields, spend time with people that have non-traditional career paths, people who take sabbaticals, people, there's a whole community called the Retire Often community, and this is professionals who believe that it's natural and healthy for a career to take extended breaks. So I think those would be the two things. What you're feeling inside is okay, and in coaching, we can make some space for that and really talk about it and normalize it. And then also get out of your silo and find like-minded communities outside of your silo.
How about within the academic medicine space? And I know that you have involvement there. Do you see the tide changing away from the prior generation's mindset and maybe giving space that there is a life and identity outside of clinical medicine?
Well, I see a lot of work happening there and a lot of culture change. And as you know, culture change happens slowly. And the way that it happens is by bringing people together to talk about these ideas. And the Wellbeing Champions Committee that I oversee is a great example of that. I do see that glimpse of culture change. And actually, this is a nice segue into the next of my five things.
Hmm.
I'm not sure if we're going to have time to talk about all five of
Sure.
them, but
We could just do one.
we'll talk about my favorite ones for today. And if you want to know about the other ones, read the article. But, another thing that I think we need to stop doing in healthcare is asking doctors to run well-being programs without resources and asking them to be volunteers in this role. So we've done an amazing job in healthcare of shining a light on physician well-being, why it's important, and even having most institutions have a chief wellness officer and a wellness committee. But a lot of the well-being champions that I talk to around the country are volunteering and they don't have a budget for any wellness activities. So there's a disconnect there. And I think where this touches on the work-life balance issue is that the people that are most passionate about well-being end up doing extra work on top of their regular jobs. And the work of a well-being champion is very prone to burnout, actually, because they're hearing a lot of the problems every day.
Hmm.
They're hearing the things that are distressing the physicians they work with. People come to them with complaints and challenges, and then they don't have any money necessarily to actually address the things that are really at the core of the problem. So the work of a well-being champion is prone to burnout, and that could be a real dichotomy is that these well-being champions really care about changing the culture to make it a gentler culture, but on the other hand, there are so many obstacles that they're up against, and they find themselves kind of pulled in all those different directions.
And when you say resources, it's not just money, but of course, as you alluded to, time as well, right?
Time, and time is so valuable for cultivating your own work-life balance, and time is really needed to do the work of physician well-being, which a lot of the time it's changing workflows in clinics, making clinics run more efficiently. That takes concerted effort. You need to do things like having a daily or a weekly huddle to make sure that the continuous improvement is happening. And that doesn't happen when it's just a volunteer effort and there's
Hmm.
no dedicated time to make those programs work.
So give us an example of maybe a successful medical institution that did invest the requisite time and money to really take well-being seriously. Because one thing I find when it comes to physician well-being is that the resources that they need to make a difference is going to come at the expense of making money. It's going to come at the expense of revenue. And not all medical institutions are willing to make that sacrifice.
I think my response to that question is it's heterogeneous where we're at right now. There's a wide range and there are some programs that are genuinely trying their best to get it right. I guess what I'll say is you might be surprised that some of the well-being programs that you hear about nationally, they have a high profile and they're doing a lot of work or publishing a lot of research about burnout. They might not necessarily be the institutions that are doing the most investing of resources and having the biggest impact on their physician well-being. And then anecdotally, I hear stories about physician groups that are run by private equity, and
Hmm.
somebody at the top was moved by a story they heard, and they just made the decision to allocate the resources and build a great wellness program. So I think, you might be surprised which programs are getting it right and which ones are getting it right by accident and which ones are falling short still.
So I think we have time for one more of your five that you would like to see in 2026. So why do we go with that?
All right. I'm going to go with thing number five on my list, which is I think this is timely in 2026. Healthcare needs to stop rolling out every shiny new technology
Mhm.
without properly vetting it and planning for the downstream effects. And this is where we're at with AI right now, and ambient AI, scribing, clinical decision support. That is all happening faster than any of us can really process. But we've seen this movie before with other technologies. The example that I'll give is the patient portal messaging, my chart messaging, if you use Epic. It was rolled out, and all of a sudden, patients could send the doctors messages anytime. And the promise of that technology, of course, was that the doctors were going to be empowered to provide better patient care. But what wasn't planned for was what was the impact going to be of the burden, the task burden, and the cognitive burden on doctors. And that the outcome that wasn't planned for was the increase in pajama time,
Hmm.
the time spent doing work outside of work hours. And over the past several years, we've been seeing some really horrifying trends about work outside of work or pajama time. And only just now are we starting to see this kind of retrofitted solution where health systems are starting to explore and implement billing for that time that's spent in my chart so that it doesn't have to be uncompensated work anymore. And I worry that, the same tendency to roll out the AI driven technologies, the promise there is these things are going to help physician well-being. And I hope that they do. I am cautiously optimistic. But I actually heard another guest on your podcast, but he
Hmm.
spoke about AI as a medical device
Hmm.
and how we should not roll out any new medical device that can impact patient outcomes without properly vetting it, doing trials. And I argue that if we're serious about physician well-being, we need to try our best to think a few steps ahead
Mm.
in anticipating what the new technologies driven by AI are actually how they're going to impact doctors and well-being.
Who would be responsible to monitor those downstream effects of these shiny new objects specific to AI? How can we go about doing that?
Well, I imagine it's got to be some kind of multidisciplinary institutional committee. It should have people that know how to do science. So it should
Hmm.
have some researchers. It should have some physicians. It should have the IT people, the ethics, legal. It should really be a multidisciplinary committee with physician voices. And those people need to stay around as the technologies are implemented in waves and continuously monitor the impact on physicians. I fear that that's not necessarily going to be the standard way that it happens. It seems that the technologies might be dropped on doctors
Hmm.
and it will be left to doctors to sort of point out the frustrations and difficulties as they come up. I hope I'm wrong, but this is how I think about and prepare for this AI rollout.
And I want to underscore what you said. We need physician voices when it comes to evaluating these tools. One of my other guests on my podcast mentioned last time there was a technological revolution. It was with the electronic medical records, and physicians didn't have a voice at the table. And we can see how that turned out in terms of upending our lives to our own detriment. So I think it is super important, as you said, to have physician voices when it comes to the vetting of new AI tools, because I do think that this is a technological revolution that may surpass that of the electronic medical records.
Absolutely.
We're on to Christie Mulholland. She is a palliative care physician and physician development coach. Today's Kevin MD article is Five Things Healthcare Must Stop Doing to Improve Physician Well-Being. Christie, as always, will end with some take-home messages that you want to leave with the Kevin MD audience.
So my take-home message is these are five trends in healthcare that are counterproductive. And if we're serious about clinician well-being, we need to stop doing them. We should continue pushing for the system to change for the better. And in the meantime, there is individual work that doctors can do, clarifying their values, their boundaries, what they're willing to accept, and what they need to negotiate for. And that's the work that I help doctors with through coaching as well.
Christy, as always, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
Thanks for having me. Happy New Year.
Happy New Year.